Speaking of shots, I know some people with allergies do get allergy shots. Do those
Correct.
really hurt for kids?
No, although, I'm not into torture in my office. So, I'm sort of very careful on the age of children. I usually won't start anybody under the age of maybe 8 or 9 on allergy shots. Um, some kids are very, are tough and it doesn't bother them. Others, it sort of does. But the shots don't really hurt that much. Now, as you go up in the higher concentration of the solutions,
Hmm.
it can sting a little bit. So, we use numbing creams and sprays and we do the best we can, but I wouldn't say that they're pain free, but they're what we use really the smallest gauge needles that anyone uses in medicine.
Okay. Now, speaking of kids, we hear a lot about childhood asthma. Um, do kids really grow out of asthma at any point?
I don't know the word grow out of it. I think there's no question that people's asthma, for a lot of kids, it gets better as they get older.
Okay.
And they have flares or symptoms a lot less frequently. But it's not uncommon for me to see somebody in their 40s or 50s
Right.
and they come in with a cold and they're wheezing and they say, "This hasn't happened to me since I was 5 or 6," because those genetics and the tendency for the lungs to be inflamed and easily irritated probably doesn't go away, but a lot of people can be less symptomatic over time.
Okay. For kids, do you have any tips for parents to speak to their kids about their asthma?
I think honesty is usually always the best policy, and but to reassure them that because it's scary, it can be very
Mm-hmm.
scary to feel short of breath and to have this sensation of cough and to wheeze, and I think it's important to reassure them that the medicines, that we have medicines that are going to make them feel better, and that work. I mean, the medications that we now have to treat asthma work wonderfully, and the incidence of asthma deaths, and exacerbations has gone way down in the last 10 to 15 years because of the wonderful medications that we now have. And I think to reassure them and to have open and honest communication with the child about what their symptoms are, because when the parent sort of is in touch with their children's symptoms, then they can really help. They can tailor treatments themselves and help me help tailor the child's treatment.